Hi, Dr. Lieb. How are you?
Hi, good. How are you?
I'm good. Thanks for joining me today.
Thank you.
We're going to talk PCOS, one of our very favorite conditions that we treat. So you're the expert. Tell me a bit about PCOS. So what is it? I understand there's two types.
Yeah, so it's really an imbalance in sex hormones. Um, and it's categorized into two types. So it can be dependent on insulin resistance or it could be an adrenal issue that's contributing to it.
Cool. So symptom-wise, what do you usually see with PCOS patients?
Usually, these women are having irregular periods. They might be having head hair loss and then having excess growth of hair on their chin. They might be having acne, which is usually in the same distribution, like along their chin. And then usually difficulty losing weight.
Right. Okay. Good. Yeah, those are the typical things. Um, and as far as diagnosing PCOS, like it's a little tricky, right? But what are the typically the three criteria that are used
Yeah.
for that?
Yeah. So technically, to be diagnosed with PCOS, you need to have two of the three criteria. So it would be elevated testosterone, and that could be on lab work, or it could just be symptoms. And then irregular periods. And then the third, which is like not commonly seen, but is like the name of the condition, is polycystic ovaries. So seeing multiple cysts on ovaries on ultrasound.
Okay, good. Yeah. So you don't need to have cysts on the ovaries. That's oftentimes why I tell patients that this should be renamed something
Yep.
and recategorized. And it's often missed by doctors or misdiagnosed, right?
Yeah, because the symptoms are so common and are easily covered up by things like birth control, things like that. Yeah.
Exactly. So, the treatment for it is fascinating in that respect. What no, tell me about causes. I mean, I know this is a complex discussion, but typically what are the causes that we see with PCOS?
Yeah, it's really tricky to tell. So usually it's like environmental, so maybe like prenatal exposure or even a genetic component. So asking a little bit around with like family history, things like that can be helpful for some patients to hint them into if they might have PCOS. Um, Diet is like one of the biggest causes just because patients might not know how to be eating optimally, and that can lead to insulin resistance. And then stress and inflammation are also
Yeah.
going to contribute to it.
And stress is a big one. The adrenal component of PCOS, I think, is missed a fair amount, which is why we like our testing, the testing that we do, that we look at this. And we'll talk a little bit about that. But
Yeah.
but conventional treatment, tell me about that. Like we get a lot of patients who come in on birth control, all
Yeah.
kinds of things, right?
Usually they're just being told to be put on birth control right away, which is just going to cover up the symptoms. It's not going to treat why they're having these irregular cycles. And if not birth control, then usually metformin, which is going to help with the insulin resistance, or spironolactone, which is going to help to reduce those excess testosterone symptoms.
Right. And so we get patients who come in oftentimes and say, well, I don't want to be on these medications forever, or they're not working, or what can you do for me? And that's where the naturopathic approach comes in, which is really cause based. Like we're really trying to get at the root of it. So testing wise, what tools do you typically use when you're starting to try to get at root cause?
I usually start with in-depth hormone testing. So we're looking at not just how the body is producing hormones, but how they're also being broken down, because that can have an impact on symptoms more than just looking at it in the blood. We'll usually just see your testosterone might be normal, but you're still having excess testosterone symptoms. And then cortisol testing with saliva is so important. But then also looking at nutrient deficiencies is helpful, because like vitamin D, things like that are important for cell signaling and can help with insulin sensitivity.
Yeah, it's complex. And you and I talk about this sometimes, how even if a person doesn't look like a classic PCOS picture, if they're trending in that direction and
Yeah.
count symptoms, then we treat them, right?
Yeah.
So yeah, it's not always cookie cutter as far as the lab work goes. So
right.
Yeah. So treatment wise, tell me what are your go-tos typically?
So first and foremost is diet changes.
Mhm.
We need to have the proper balance of macronutrients. So looking at protein is so important, and fats and carbohydrates, having that right balance. That alone, usually I find, makes the biggest difference. And then other lifestyle factors, so like exercise, most of the time women with PCOS are over exercising because they're
Right.
trying to lose weight. But that excess exercise can lead to more inflammation, more cortisol being produced. So usually I'm having people like reduce how much they're exercising, focus on strength training. Beyond that, I'm also looking at food sensitivities because that can contribute to inflammation.
Right.
And then just replenishing nutrients.
Right.
Yeah.
Nutrient, huge. B vitamins, D, you know, that's why it's such a personal approach with people. There's no one size fits all. And supplement wise, like tell me, I mean, there's so many, gosh, I mean, we have so many tools in the toolbox, but tell me like your top 2 or 3 that you like.
Definitely inositol, that is so important. And then spearmint tea I find to be really helpful.
Great for testosterone. Yeah. Those are 2 biggies. But you know, as we always say in naturopathic medicine and functional medicine, like it's personalized, right? Everybody is going to be different, and it really depends. And so, can this be cured? We get this question all the time, right? So
yeah, and it's so tricky because symptom relief will come relatively quickly within like a reasonable time frame, within a couple of months, and long term it has to be managed with like diet, lifestyle changes, and that's where I see the most help for my patients. Yeah,
right. So we can kind of get people into almost like a remission. And almost take away all these supplements too. I always describe the supplements as like training wheels. We can take these away and manage it long term with diet and lifestyle. So there's hope, right?
Yeah.
So, well, thank you so much. This has been super helpful.
All right, thank you.